of today, I would request Professor K.C. Singhal sir, patron SoPI, Dr. Shanti Pal ma'am, to kindly grace the stage as chairpersons for the talk.
Let's have a two minute cool down period. Yes, doctor. Till the chairs are in place.
So now we will begin our first session today, which is Professor K.C. Singhal oration. I would request Professor K.C. Singhal, patron SoPI, Dr. Shanti Pal Ma'am, Team Lead Pharmacovigilance Medicine, WHO Headquarters, to kindly grace the stage as chairpersons of the talk. Professor Krishna Chandra Singhal, he is patron of the Society of Pharmacovigilance India and a former Vice Chancellor of NIMS University, Jaipur, India. Dr. Singhal's primary research interests include pharmacovigilance, clinical pharmacology, and chemotherapy. He developed a novel method for screening potential antimalarial agents. He has also served as professor and chairman of Department of Pharmacology at Jawaharlal Nehru Medical College, AMU, Aligarh, before becoming the Vice Chancellor of NIMS University in February 2008. He has held significant leadership roles with several scientific organizations, including serving as President and Treasurer of the Indian Pharmacological Society, President General Secretary, and Treasurer of the Indian Academy of Neurosciences. He has been a president and chief editor of the Indian Journal of Pharmacology. Dr. Singhal has also been an editor of the Indian Journal of Physiology and Pharmacology, vice president of Indian Society of Hypertension, and president of the Society of Pharmacovigilance India. He has contributed as a consultant in clinical pharmacology for the Committee on Essential Drug Categorization and continues to serve as the patron of Society of Pharmacovigilance India. Additionally, he is a member of the advisory committee of the National Pharmacovigilance Program and the Apex Committee on Pharmacovigilance for Ayurveda, Unani, Siddha medicines under the Indian Medical Association.
So, ma'am, we welcome you to chair the session for the oration. For the oration, I would like to invite Dr. Yvonne Yesiku, Lecturer, Ghana College of Pharmacists, Ghana, for her talk on advanced pharmacy services and pharmacovigilance. A brief introduction about ma'am. Ma'am is a pharmacist, a pharmacologist, a lawyer, a management consultant, and an educator. She has experience in leadership, governance, policy, and human resource management. She has been involved in the development of policy and training documents and has led and participated in the drafting and review of constitutions and bylaws for a number of organizations. She has lectured in the areas of pharmacology, toxicology, medical law and ethics, and leadership. Ma'am has played a lead role in the management and implementation of several projects. She also has a particular interest in medicine safety. Ma'am is also the immediate past vice president of the Pharmaceutical Society of Ghana. In that role, she led the drive to extend pharmaceutical services in improving public health and served as chair of the disciplinary committee of the society. She is also a fellow of the Ghana College of Pharmacists, fellow of the National Safety Council Ghana, fellow of Pharmaceutical Society of Ghana, member of the International Society of Pharmacovigilance, and editor-in-chief of the Ghana Safety and Health Journal. An interesting thing about ma'am, in her spare time, she also provides family life counseling. Please welcome ma'am.
Thank you very much. I would like Professor and Dr. Yes to thank the organizers for this honor to deliver the Professor Casey's operation for this conference. I am particularly honored and humbled because to deliver this oration, I have here Professor Singhal himself, and considering his contribution to pharmacovigilance, it is an honor and a privilege to be able to make a contribution to suggest some ways forward with pharmacovigilance. Madam, thank you for your presentation. It was very insightful, and I have picked quite a few. My topic today is advanced pharmacy services and pharmacovigilance. My name is Yvonne Isiku. I'm rector of the Ghana College of Pharmacy. So this will be our outline for today. And just to take a look at the evolution of healthcare delivery and pharmacy practice over the years. I believe you will agree with me that years ago, the focus of healthcare delivery was treating the disease. We wanted to identify what was the problem with our patient, what the patient is suffering from, and treat it and make them better. But now we are looking at treating the patient because we understand that the disease in one patient may be different from the disease in another patient. It may be the same disease, but how we treat it in one patient should be different, considering the patient as a whole. And now we're also moving into looking at the health of the community. So we have looked at public health. We want to engage community members. And in that regard, we look at disease prevention, health promotion. We even look at rehabilitation when the patient is better. And now we also, and it's great to see that today, as part of this conference, we are looking at a session on ecopharmacovigilance because that is also interested in the community. We want to see when we have given the medicine to one person, how the person handles it, how it affects the environment, and therefore how it affects the whole community. All of these are important aspects of patient safety. Now, we also want to look at the client after the disease. The person is fine. Now, what do? Is there a way to prevent a recurrence? Is there a way to ensure that they maintain health? Sometimes the condition is such that they may lose some capabilities. What is the implication for that? And so we now look at total patient care. When we look at pharmacy practice, I have some spices at the side of my screen because it is, in a certain way, how pharmacy has developed. The people we call pharmacists today, of which I am one, started off as spices, moving from one place to the other, sending spices and herbs, telling people about the health benefits of using these condiments in their meals or even taking them alone. Then there was the part that the people who were called alchemists, who some people saw in a certain way as a kind of magician, because they were propounding some theories that did not make sense. And they were looking into some chemical formulations. It is these people who came together looking at the plants, the herbs, the spices, and looking at it in a scientific way. These are the people who are the pharmacists of today. So these spices and alchemists moved to become preparers of concoctions and decoctions for physicians. So the physicians will take the patient, treat, diagnose the condition, and then they wanted some preparation for them, and they would rely on the apothecary of the time to prepare a concoction or a decoction for them. They also prepared pills and poultices which were applied for various conditions or taken for various conditions. And they supplied with time. The physicians were not only taking the preparations from these apothecaries, but they were now sending the patients to the apothecaries for the treatment, for the pharmacological treatment of their conditions. It is from these apothecaries that today's pharmacists arise. Today, we are dispensing medicines. We are designing new drugs. We are developing them. We are producing, indeed, we are reformulating old preparations for new treatments as we discover new uses for old drugs. Now we are involved in health promotion. So we go into the community. We tell our community members, do not use the medicines this way. Rather, live your life in this way and you will be better. We also are involved in disease prevention. We don't just wait for the person to get sick. Even though in some instances, considering that we produce drugs, it would appear that it would be better if our people were sick and they came to us for their drugs. But now we are talking about preparations that will prevent their conditions. We are talking about disease management. So in some jurisdictions, you will find that when the condition has been diagnosed, in some places, the patient is actually taken to the pharmacist, a prescribing pharmacist, who will then prescribe. In other places, the physician will still prescribe, but will take into account information that is provided by the pharmacist. Yet in other places, when the physician is going on their ward rounds, checking to see that how the patients are doing, they are accompanied by the clinical pharmacist who goes with them on the ward rounds, makes contributions, makes input into the management of the patient's case. We are involved in palliative care. Palliative care, we know, is not just end of life care. But when the condition that our patient has been in is such that it diminishes their competency in some way, we try to help them maintain a certain quality of life. And that is part of palliative care. And because the majority of palliative care is based in medicines, pharmacists are playing a critical role in palliative care. We are also involved in rehabilitation. The patient is fine. They have to come back. And I think that was one of the pictures that Dr. Shantipal showed, which I found it was in a certain sense comprehensive. When we look at the people who suffered from the deformities and where they are now, when you look at the progression, getting them back into society, getting them to live with those diminished capabilities. These are all things that pharmacists are involved in. I mentioned patient counseling earlier, but in addition to that, pharmacists are involved in giving other healthcare professionals guidance with respect to the use of medicines. We know that one person cannot know it all. And so when one person knows what it is, knows how to find out what it is that concerns a patient, the condition, and the other knows how to manage it, and the other knows how to care for the patient, the other knows how to effectively diagnose, then together, all of these healthcare professionals come together to make sure that the patient is fine. And so pharmacists have played this role. Pharmacists are involved in community engagement. Pharmacists are involved in medication therapy management. Indeed, one of the things is that some patients or clients who may be on long-term medications, periodically, they pick up medicines along the way. I mean, the person has a headache, the person has some running stomach along the way, has some issues, picks up medications. How do these medications go together with the medication they are supposed to be taking daily? And these are some of the things that pharmacists intervene, review the medications of their patients from time to time, help them to use their medications optimally so that there is better patient outcomes. Pharmacists are involved in immunization services, from dispensing the vaccine to administering the vaccine to ensuring the proper documentation of all that has happened with respect to the vaccine. Pharmacists are involved. And now, as we are talking about AI, pharmacists are not left behind, but looking at electronic pharmaceutical care service delivery. And it's on the rise, it's everywhere. Indeed, in Ghana, there is a national electronic e-pharmacy platform which allows every community pharmacist to plug in to ensure that everybody who anywhere can have access to some medication, and it could be very close to them, or it could be delivered. Maybe I am paying for it, but I'm paying for it for my father who lives elsewhere. It can be delivered to him, and there will be a pharmacist who will be speaking to him on how to take the medications. So when we talk about pharmacy practice, yes, I mean, this is a definition we don't go into. But what are the requirements for effective pharmacovigilance practice? I believe that there is a need for an understanding of the pharmacological activities of the medications and the vaccines, and also an understanding of the potential interactions between the medications and various other things, even the food that our patient is taking. There is a need to know potential side effects, and this will be rooted within the understanding of the pharmacological activities of the medications and the vaccines. Also, how we know that the side effect is starting. Sometimes it takes a bit of time for the side effect to materialize fully. There's a need to understand that when we see these symptoms, a little rash here, tightness in the throat, itchiness on the tongue, we should know that something is starting. And then what are the reporting mechanisms and what options are available for us? So I think one of the things that our workshops this yesterday pointed out was, I mean, in both of the workshops, was how to report. So understanding of what is available, the options that are available for reporting, and which one to choose at what time. And also, there is the need for a grasp of the initial management of the symptoms. Once again, rooted in the pharmacological activity of the medication, and therefore how to effectively respond to them. What are the referral mechanisms that are available, and what to do to follow up effectively within the community? And I believe that one of the ways, follow up, community engagement, is something that community pharmacy practitioners are very strong in because they are in the community. And as we say that the community pharmacy is the place that you don't have to dress up to see a healthcare professional. I mean, if you have to go to the hospital, you prepare. In the community pharmacy, I want to believe it is the same in India, but in Ghana, people go in their pajamas and they enter the community pharmacy because it's a relaxed environment. So what do pharmacists do? Right from the design of the drug, of the medicine, to the production, pharmacists are involved to ensure that pharmacovigilance is taking place. So the medicines are now more and more, there is now more targeted medication so that we get better results. Pharmacists are involved in public education so that in Ghana, for instance, during the World Pharmacist Day, we make a lot of noise. In every community pharmacy, there is free medication therapy management. You walk in with your medicines. Indeed, we set up mobile clinics. We go to the markets. We are involved in this way. The Lady Pharmacists Association of Ghana is one other group that does that periodically for various World Health celebrations, we go into the community. We're involved in public engagement. We educate patients on and clients on their medications. We inform other healthcare professionals on the medicines and vaccines they should use for their patients and clients. We do follow up. And so when patients are being discharged from the hospital, the pharmacists are involved in discharge counseling so that they know we are changing the medication. Now you are moving to medicines that you have to monitor. This is how you have to take it. Take it before meals or after meals, before you go to bed or first thing after waking up. Indeed, in some instances, we set their time for them. We set their alarms for them so that they know that at this time they have to take their medication. And also when they come to the pharmacy, we do similar activities, we perform similar activities for our patients and clients. Pharmacists are involved in the research of potential pipelines for medicines. And I'm glad one of the things that came up earlier today was antimicrobial resistance and stewardship. Pharmacists are leading antimicrobial stewardship programs all over the world and ensuring that the antimicrobials are working or at least are being preserved in such a way that they will take us further. Until new ones are designed and are brought into the system, what we have must take us a long way. And pharmacists are involved in the effective management of medical logistics and supplies, including cold chain. I cannot talk about what happens in India, but in Ghana, we have had instances where somebody has been given the anti-rabies vaccine and has still gone ahead to develop rabies because the medication was not stored properly. The vaccine was not stored properly. So really, at the time it was being administered, it was water for injection that was administered. And so this proper handling is something that pharmacists ought to be involved in because they understand the mechanism of action of the medication and how to ensure that we maintain the pharmacological activity of the medication throughout the supply chain. When we talk about advanced pharmacy services, what are we talking about? The Pharmacy Council of Ghana, and I'm just taking this and adding a few words, they have said that advanced pharmacy services involves the application of specialized knowledge and skills to improve patient outcome and health outcomes, patient care and health outcomes. Now, these services include, and I've just listed a few because I don't want my slide to be too busy, and I thought these would be a bit relevant to us. Oncology pharmacy services, infectious disease management, immunization services, medication therapy management, and stewardship for medicines and other health products. So these are some of the services which we can say have been teased out of the traditional service delivery of pharmacists and are being enhanced so that the specialized knowledge that goes with it will ensure that we get optimum outcomes for our patient. What can we expect when a patient or when a pharmacist is providing specialized service and a patient or a client is receiving specialized advanced pharmacy services? Specialized skills. The pharmacist is specialized in the delivery of a particular skill. I mentioned, so for instance, okay, we'll get into that. Let's park that for now. Then there is focused patient care. There is specialized support for medical and surgical services. So it's not the general service that is given, and also that the specialist medic, the cardiologist, the surgeon does not have to know all the current medicines in their heads, and so can get that kind of specialized support from the pharmacist who is providing advanced pharmacy services. And there is confidence in the delivery of service. You know, sometimes it's not that the person doesn't know what they are about, but maybe when you look at their faces, you are not sure that they know what they are about. They may know, but you cannot see that they actually know. And that's because there isn't confidence. But among pharmacists or among healthcare professionals who have been trained to provide specialized services, because of their training, because of the exposure that they have had to various conditions, they are better able to provide services. And these all lead to improved patient outcomes, not only in the clinical setting, but also the community. But let's imagine what could be. I mean, it would be great, wouldn't it, if each patient got what was good for them and ensured that they did not develop any side effects, any adverse effects, and they would recover in the shortest possible time, go back to their work, and go back to becoming productive members of the society. And that is a dream, but then again, now with the advancement of AI, it may be closer than we think. And so it is important that we also consider something like ensuring a seamless integration within the health system, so that when the physician has taken care of the patient and they want some particular medication for a patient, wherever the medication is available, the patient can access it. And if it means delivering the medication to the patient's doorstep, that is done. And yet accompanied by the information that is needed, the appropriate follow-up to ensure that the patient gets everything that they need. And so it's necessary also for us to leverage what we have in technology now to ensure effective public health delivery. Then from production to consumer, we have to ensure that the medicines are kept and transported in such a way that the consumer gets the most out of it. So storage conditions and a proper cold chain. So I want to propose that these are possibilities if we all promoted advanced pharmacy services, that there will be better prevention of adverse effects because there will be targeted medication design and development, targeted medication use. Indeed, the WHO says that about 50% of medicines are wrongly prescribed, wrongly dispensed, wrongly used. But if we are going to ensure advanced pharmacy services, then we could reduce that. There will be avoidance of interactions because there will be an understanding of how the medicines are working with other medicines, with food, with the conditions that may be present. There will be faster identification of issues, PV issues that are important because there will be a clear understanding of the pharmacology of the medication that is being used for a specialized service. There will be a knowledge of nearly every possible interaction that these kind of medications can have because that is specialized And it's not that every pharmacist should know every medication, or every doctor or every surgeon should know about every medicine that is relevant to the particular condition. And there'll be a clear elucidation of the physiological pathway of all the medications that are being used in that particular service. And there'll be an understanding of the activity of these medications. Also, because of a clear understanding of effective counter activities that will help respond, and also an exposure to various symptoms of relevant adverse effects, as well as experience in handling adverse effects in the past because of the training that these specialized professionals have received, there will be a quicker response to any pharmacovigilance issues that arise. There will also be a clear understanding of the possible pathways for resolution, effective patient engagement. So sometimes the patient has a response, doesn't know what to do, doesn't even understand how to express it. But that specialized knowledge allows that effective engagement and also effective communication skills, which is one of the things that we ensure we do with our training of specialist pharmacists at the Ghana College of Pharmacists. And effective counseling and the expression of empathy. Recently, I was in a conference, and one of the things, a meeting, maybe I should call it a workshop. One of the things that came up was empathetic counseling. And the fact that sometimes you have the knowledge, you know what you want to share, but it is not going down, it's not being received because the patient is not identifying with you, or they don't see you as identifying with them. These are things that we need to harness and utilize. As public health experts, and understanding how to enter a community effectively, as well as integrating services into community activities. Those providing advanced pharmacy services will ensure better public education. Now, I'll talk a little about the Ghana College of Pharmacists and what we are contributing to pharmacovigilance. Our mandate and our objects are to train specialists in pharmacy and related disciplines. We certify duly trained specialists in pharmacy and related disciplines. We contribute to policy on health, medicines, and public health. We publish current scientific journal in our GCP journal and our quarterly newsletter. And we design short courses to equip practitioners with advanced pharmacy practice skills. This is our vision and our mission. We want to become a college of choice, and we hope to do that by developing programs and imparting them for effective pharmaceutical care. Our areas of specialization. These areas, we have specialization programs where pharmacists go into residency in teaching hospitals and come out with a training. But it's not only in clinical pharmacy. So when it is in, for instance, drug design and production, they go to the pharmaceutical industry for their rotations. They also go to community pharmacies when we are talking about, for instance, community health management, medical logistics and supply. And they also go to the Ministry of Health to talk about how to develop policy and all that. But these are a few on the left side are a few of the specialization areas that we have in clinical pharmacy: oncology pharmacy, infectious disease, emergency care, cardiology, mental health, and palliative care. We also have quality assurance and quality control, which is with respect to drug production and design. But we have some short courses because our residency programs are 2 years minimum. You have to be in residency for 2 years. and not everybody, particularly those in the private sector, can leave their jobs for 2 years. And so we have short courses which build the capacity of pharmacists to allow them to practice at an optimal level. And so we have, for instance, our pharmacist vaccination program, which has been a great success. We have a training for handling of oncology medications, which has gone throughout the West African sub-region. So we are not only training pharmacists from Africa, but across the West African sub-region. Indeed, we've had contacts with Rwanda and DR Congo to build the capacity of pharmacists in that area as well. We have asthma managers training, which is designed for community practitioners, so that when there are clients who have maybe asthma and need support, whether it is utilizing their inhalers or ensuring that their flares and attacks are under control. We have diabetes educator training program, which is also for community pharmacists. We have the qualified person for production. We have various production lines, specialization, but it's a 6-month program. Only 2 months are done on the campus or at the Ghana College. The rest is done on the field. Then we have our medication therapy management, which is for clinical pharmacists and pharmacists in community practice. We collaborate. We believe that we have a tribal saying in Ghana that if you want to go fast, go alone. If you want to go far, go together. So we believe in going together because we think we want to go far. And so we've collaborated with quite a number of institutions, including the Tata Memorial Hospital in Dubai. All the teaching hospitals in Ghana are collaborators. We have collaborated with PATH and the University of Washington, collaborate with World Child Cancer. Indeed, the 3-month rotation that pharmacists undertake at the Tata Memorial Hospital, pharmacists from Ghana undertake at the Tata Memorial Hospital, is sponsored by the World Child Cancer. We collaborate with Empower School of Health, which is headquartered in Delhi. We have collaboration with Novartis in their Value Chain Academy, as well as the College of Health Sciences of the Kwame Nkrumah University of Science and Technology. So what are the next steps? How do we move forward? I want to propose that we pursue the training in advanced healthcare practice and service. For all of us healthcare practitioners, our primary training exposes us to general practice skills. As we practice, we develop an interest in maybe a particular area. I will encourage all of us to pursue advanced training in those areas. And since all of us here are here because we love pharmacovigilance, I want to propose that we all find a way to pursue advanced training in pharmacovigilance, which is why the workshops yesterday, which were so well attended, was great. It's important that we not only undertake these workshops, but apply the skills that we acquire. We learn. At the end, we were all told how to actually report. Please, let us report and let us ensure that we are utilizing the skills we are acquiring. And then when we are in a place like this, it's important that we network. It's important we network because in all the places that, my apologies, but in places I have lectured, I tell them that you do not know where next you will meet the person sitting next to you. Today we may all be students, but tomorrow, 5 years, 10 years from now, you have no idea where that other person will be. It's important that we build networks. And so when we are in a session like this, don't be in a hurry to rush out. Find time to smile and talk to a few people. Some of us have short memories of names, particularly names we have not rehearsed. And so maybe if I meet you, you mention your name, I'll ask your name again. Forgive me, but I will remember your face. So let's engage because you have no idea. And these networks also help us to ask. As a healthcare professional, once again, I do not know what the training is in India, but when I was training as a pharmacist, we had one particular professor. Objective questions, if you get it wrong, it's -1. If you don't know and you leave it, it's 0. So it's as if how you normally would get wrong. So people could finish the exam and have minus because he said that you are going to deal with people's lives. Don't guess if you don't know. And these networks will allow us not to guess. So you can call the other person. The other day you were talking about this case that you had come across. I think I'm seeing something similar here. How did you handle it? But you can only do that when you have built this strong network of healthcare professionals. And let's continue to engage. Let's get information. Let's be updated with current trends. And as we do that, we will know what is happening in other areas. When something new comes, we may be better prepared because sometimes it is new, but an exposure to some old things that may have happened allows you to better process the information that is in front of you. And once again, for all of us here, we really are interested in patient safety and pharmacovigilance. Let's not forget that. Let's not forget that. Patient safety, pharmacovigilance is critical. We were assured by some of our speakers earlier today, including Dr. Shantipal, that this is the most important. Patient safety and pharmacovigilance. And I think I would like to propose a collaboration with institutions like AIMS so that we can equip pharmacists to provide advanced pharmacy services and improved pharmacovigilance activity. Thank you.
Thank you, ma'am, for such an informative talk. Now, I would request the chairpersons and Sandeep Agrawal, sir, to felicitate ma'am. Zia Rahman, sir, is also with us. Great, ma'am. Is a prestigious Casey Single oration. On the occasion of that, we would like to felicitate you all, ma'am, by our chairpersons and Sandeep Agrawal, sir, President SOPI, Dr. Syed Zia Rahman, sir, Chief Secretary, SOPI. We, we have our chairpersons with us, Professor Casey Singhal, sir, Dr. Shanti Pal, ma'am, to felicitate Dr. Yuan, ma'am. Now I would request Dr. Juan D'Souza ma'am to felicitate our chairpersons, Professor Casey Singhal sir and Shantipal ma'am.
Thank you so much, everyone. Now we'll proceed for a quick tea break, following which we have the upcoming parallel symposias running in LT5 and LT6. In LT5, we will have symposiums 1, 3, and 5, and in LT6, we'll have symposium 2, 4, and 6. All are requested to kindly relocate accordingly. Thank you.
एक सेकंड एक सेकंड हाँ one sec you take the fifth one to see whether यहीं पे भी आ जाएगा ना कुछ हिला हुआ है how do I do going enter चाहिए ना like I just want to see no you can do the other mode also how do I do like this
Yeah,
enter like
I'll come and do for you.
so I just want to see नहीं नहीं सर वो oh one slide इसको पीछे कैसे जाऊँ one of the slide is not okay just एक मिनट
स्लाइड चेंजर
एक मिनट बेटा
बंदा ना स्लाइड चेंजर ले लो
एक सेकंड इसको पीछे जाना स्लाइड को one of them is not okay oh god नहीं पीछे जाओ हाँ this one इसको ठीक कर सकते हो हाँ एक सेकंड सर I want to bring this नीचे I'm just trying sir I use a different software तो वो दूसरे में ना हिल जाता है
हाँ ये हो जाता
just contract it
है नीचे हो जाएगा
हाँ ऊपर वाला नहीं इसको छोटा कर दो तो बेटा फोन भी छोटा कर इसको छोटा करो हेडिंग बट ये नीचे जा रहा है ठीक है सर एक सेकंड सर maybe just will it come full slide over there?
Or one thing I can do, boxes I can do.
No, don't do anything. Just ये थोड़ा सा ही कर दो, छोटा font कर दो, doesn't matter. I go in a minute. I don't have to. But what happens is, फटाफट हो या. Give me 5 minutes, sir. You can decrease the font size. It doesn't matter. थोड़ा सा. Oh, wonderful. पीछे जाना. तो ठीक है. हाँ, पीछे जाओ. ये इसको नीचे कर दो थोड़ा बेटा. छोटा कर दो इसका font size. बस छोटा कर दो. I'll take finish fast, sir. I have a meeting which I'm postponing online, sir. यहाँ पे इसको ठीक कर दो छोटा कर दो, फॉन्ट साइज छोटा कर दो. Oh, मतलब what I mean is I just wanted to come से नीचे, that's it. चलेगा. Okay. Decrease. Hmm. इसको okay done. You want me to work through the pen drive only in case? No. On the desk. Because the other pen. इसको छोटा. हाँ okay.
The space कम कर.
I use a different software, so थोड़ा सा issue रहता है. One and a half space कम. एक सेकंड पीछे जाना. ये डॉट्स आ रहा है, ये बुलेट क्या करें? डोंट लाइक बुलेट्स. क्यों आ रहा है बुलेट्स हर नाइट में? तो जो ब्लैंक उसमें आगे चलिए. ये 3 बुलेट्स भी हटा सकते हैं तो हटा दो.
Computer.
ये हटा दो. हाँ डोंट ज़्यादा मत सोचो. और भी जगह आ रहा है. दिस वन. कैन यू जस्ट गो बैक? ये हटा दो. दोनों हटा दो. कम ऑटोमेटिकली. The other software picks them all. This is some silent AI with the listen.
देखिए कितना होता है.
That's it. Now copy this. It won't shake now, no? Take the end. Oh, okay.